Well, hello everyone. This is Dr. Ellithorpe with Tustin Longevity Center here in Tustin, California at Ask the Doctor Anything. We are a functional medicine general practice with various allopathic and physician assistant as well as gynecological consultation available for the functional medicine questions you might have. We do this every Tuesday at 6 o'clock to 7 o'clock. And normally I have email questions. I don't have any today, so that's unusual. But I think there was a information glitch in getting them to me, so I will try and get to them. Maybe that's my son calling me about the. Yeah, it is. Just a second. Hello.
Hey, I printed that question sheet to your main office, and your live stream is now up and ready to go.
Okay, thank you. I'll go and check and see if it came through on the computer, the questions, right?
Yeah, I printed them to your printer in Suite L, and you should have the live stream ready to go.
Okay, thank you.
Call me back if you're having any trouble.
Okay, I will. Thank you, Talon. Bye-bye. All right, let me get up and see if the email questions came through. I'll be right back. Well, there you go. This is live here at Tustin Longevity Center with our TLC Health Freedom Tribe. Okay, let me put something in the chat. I'll say hello, TLC Health Freedom Tribe. And I'll put that in. And so you can, if you have a question, you can put it in the YouTube and question there. You can also send me some emails, and these emails you can get if you go to tlcdoctors.com, tlcdoctors.com, and there you can see a link for our newsletter, and you can get on that at any time. And they will notify you of these videos. Plus, they will send you a link, and that link you can type in for Ask the Doctor Anything, so I can get the email question here for our Tuesday night live questions. Okie dokie. So let's start with Tiziana. We have some live questions here. Hi, Tiziana. She says, hi, Dr. Rita. Can you explain what methylene blue and NAD are good for? Well, they're both powerful antioxidants that scarf up free radical atoms, electrons, damaging reactive oxygen species. And these are generated every day in your mitochondria, in your cell functions. And if they are generated to excess, let's say if you eat a high carb diet, you don't exercise, you don't drink enough water, you stay up late, you never go outside and get healthy, light exposure. These excess free radical oxygen species are picked up with antioxidants, and these antioxidants are massive. We have all kinds. We don't know them all. We know of thousands, tens of thousands of them, of which methylene blue is one, and nicotinamine adenosine dinucleotide is another. NAD is part of the mitochondrial energy transfer in the system there. Methylene blue is more of a synthetically created antioxidant. Both of them work to reduce free radical damage, and that's what will all cause us to die. That picture I have, get it right here. This is a picture of free radical damage to your cell membrane. That's what will happen to your cell membranes if you have not enough antioxidants. If you don't eat enough healthy phospholipids, proteins, and fats, then you won't be able to repair it. So what you want to try and do is not damage your cell membranes as much as possible. And that is only achieved with a healthy lifestyle. And we always review what that is. It's drinking about half your weight in pounds as water ounces every day. So if you're a 200-pound man, 100 ounces. If you're a 150-pound woman, that's 75 ounces. We also recommend get some time outside in the infrared light, grounding with your bare feet in the grass, so the ions from the earth can coordinate with the electric nature of your body and chemistry. The infrared can amplify the structured water in your cells and on all your membranes, so that morning 2 minutes standing on the wet grass is like getting a healthy vitamin from God, from the sunlight and from the ground every day. Get a good night's sleep. Eat a very low carb diet. Try and eat from natural occurring foods. Stay away from all packaged, barcoded type foods. We recommend the older you get, that you shift to avoiding dinners and you eat more of the breakfasts and lunches. Try and stop eating after 3 in the afternoon. If you're younger and it's easier for you to skip breakfast and just have lunch and an early dinner, finishing by about 6, then that would be acceptable. But late evening, late evening eating is very hard on older people, anyone over 60, 65. The food sits in the stomach too long. And if you eat at 7, there's no way by 9 o'clock, when somatostatins are to be released, that's going to get cleared out of your gut. And that'll shut off the healing God likes to give you every night. So God gives us somatostatins through the melatonin that is secreted along with the somatostatins based on where you are on the planet, which should be 9 o'clock. So that's the arrangement of the universe and the planets. That happens to electromagnetically impact you in the dark to release these somatostatins. So that's your evening dose, but you got to be in bed and you have to be at dark. So 9 o'clock it starts. And then he gives you the infrared light in the morning and the dew on the grass to ionically reboost your electrochemical nature every morning. So it's like every 12 hours, God is hugging you with health, hugging you with health. We should make some kind of a jingle with that, hugging you with health. All right, now, so that's what that is, Tiziana. Hopefully that will let you know. But why should it just be any one versus another? For instance, why don't we talk about resveratrol, or why don't we talk about vitamin E, or the tocopherols, or vitamin C, or sulforaphanes, or we could just go on and on about wonderful, wonderful antioxidants he makes. So it's like marketing. It's the flavor of the month. So we're all talking about that, but we're not working on the basics. So and exercise, I didn't bring up exercise, how weightlifting is extremely beneficial for your muscle mass to carry you through into your older years. Now, Saturday, I just went to, one of my patients turned 100 years old. I first started seeing her and her husband in the 1990s at Whitaker Wellness Institute. And it was a wonderful, wonderful party. She was beautiful. She had the microphone, was answering questions. It was just marvelous to see how well she maintained her health. And yes, she uses her natural hormones every day. She uses her natural estradiol and her natural progesterone. She takes her vitamins. She drinks her water. She emphasizes protein, and her caregivers help her do her resistance exercises. She goes to bed early. She's up early. She doesn't eat late. It's wonderful. Wonderful, wonderful. Okay. And so Tiziana said, thank you. Thank you for the question, Tiziana. All right. Now, the first question here I have is from Patricia. Hello, dear Dr. E. Question 1. What are your thoughts on tetanus booster? I don't believe we need boosters, immunization vaccines. Really, tetanus comes from being around basically the poop spatter from cows and pigs and farm animals, and that poop gets splattered on the wires of the fencing, and then the cowboys fix the fence and they get a scratch on their finger, and they'll get some of the spores and bacteria in there. Now that they might have some concern for these things, but indeed, there's really no need to do these kind of tetanus boosters at all. I don't trust the companies. They have not given us the truth on weightier matters. We all understand now that everything that they said was a conspiracy theory in the past regarding if you take a certain injection of mRNA, it'll prevent you from some viral illness. It did not. If you took the injection of the mRNA, it would then prevent you from any serious illness. It did not. You were, say, 6 feet apart. There was no science to establish that. Lockdowns and staying separated, closing down schools and work. There was no science to support that kind of isolationism. The good old-fashioned fact is that we doctors who have been practicing for 30, 40, some 50 years now as we approach, we are the ones who had the history. In fact, I was trained as a military doctor in medical management for a crisis bacterial outbreak, a crisis bacteriological, which would include everything, the radiological decontamination after exposure to nuclear war, and chemical decontamination. So I was trained in this. Never, ever did in the biological courses did we talk about quarantine, separation, or anything like that. So no, I don't support tetanus booster. Question 2, are you familiar with the House Institute? I made an appointment to address my vertigo. Yes, that's a, it's a traditionally known for balance, the, what they call it, the Barney chair, hearing, audiology. So yeah, it's got a good reputation. So I think it's a fine thing to do. Another question came in. Jill on the live says, well, thank you. She says, you are a blessing. I am 60-year-old female with TLC since last fall. My DHEA sulfate is low at 104 now, and that is low. 94 in November of 24. I take pure encapsulation DHEA daily. Should I take higher dose? Dr. Majid said it should be 150 to 250. Well, I can't speak for anything other than what we have in our nutrient shop because we test it. I can't test everything. I'm just a simple little doctor with my own private practice here. But what we test, we clinically have tested, and our DHEA 5 and the 25 and the 50 milligrams, I would recommend you probably use our 25 milligram and we should see a result. Now, I keep my DHEA at around 700. I'm 71 and I keep my testosterone. Therefore, I convert testosterone, I convert DHEA, dihydroepiandrosterone, into testosterone in my own body. And I run about 170 on my testosterone level. Well, every time I get a lab, it's flagged as high, okay? But I know I need this because back in the 1990s, when I was a much younger woman in my 40s, in my early 40s, I tested my hormones, and I was considered normal at 93 when I was 43 years old. Now that would never be considered normal for a 43-year-old today. So you can see the population averages are watering everything down. So doctors don't know where health is anymore. So I would certainly encourage you to take a known entity. We happen to have it here. It would be our brand at our TLC vitamin shop, and then retest, follow up with us, and we'll make sure that that's handled for you. The other thing is I like testosterone, and that's another huge thing. The DHEA ranges, they say, drop with age. Well, of course, and then it goes to zero when you're dead. So I like mine around 5 to 700, 750. Um, and I like my testosterone to be about 150, 170 range is fine for my muscle mass. So when I'm in my workout clothes, so I work out lifting weights 3 times a week, and that will help me maintain my muscle mass and strength. Hopefully, as I age, and hopefully, I will have a 100th birthday party too. The next question she goes on to say is, uh, I don't see PA Gonzalez until the end of April, so hope to work on it. Also, my A1C was 5.8 in November. I was going full carnivore. I know I need to get going on heavy weights. Any other suggestions? Well, Jillian, let me first make this statement. This is not meant for personal medical advice. So you're asking questions and I can give you general responses. I don't know who you are. I'm glad that you are coming here. I think this is a very good place to come for long experience and testing in the supplements and in the natural hormones, but I can't give personal advice on the YouTube. But in general, my suggestion is that carnivore is the way, and what research shows, if you want to get to your older years functional, strong, and standing up and doing your own personal self-care, you have to do weightlifting, and that means you have to eat mostly protein as you age. So when you eat it, hopefully you put it on your plate and it gets to your mouth and you swallow it. But then when it gets in your stomach, you have to digest it into your stomach as well. And so very often, all of us as we get older, even people, you say that the O type blood, the B type blood, and maybe some ABs digest pretty well until our 60th birthday. But sometime around there, all of us start not digesting as well, and food stays longer in our gut, shuts off our growth hormones at night by being stuck in our gut, and that's a pathway to our death. So yeah, go towards carnivore. That will bring down hemoglobin A1C, and if you do muscle mass, that's the engine for burning up your sugars and so forth. So yeah, I would move in that direction. Kevin says Sally Norton's book, Toxic Superfoods on Oxalates. Oh, I read Sally Norton's book. Yes, Toxic Superfoods on Oxalates and how they can cause chronic inflammation. She explains how there is no good method of testing for oxalate dumping, since all urine tests only capture a sample in real time. Do you have any recommendations on testing or verifying if oxalates are the cause of one's inflammation? No, I know of no test for that. I had kidney stones, and when I was a younger doctor, especially all the years I was an emergency room doctor, I was just racing from one emergency, one room, one sickness, one trauma to another. And I would just not drink water. And I developed kidney stones. And then I got a second one in 2014. Again, the stress of work, our stress of life, if we don't keep on having someone tell us to drink water, then we're not going to do it. So when I had the oxalate stone, and that's only 10 years ago, the nephrologist from the major healthcare system around here, who is my urology doctor, who did the surgery to take the stone out, she didn't offer me anything other than a list of paper of foods that are high in oxalates, because my urinary calcium oxalate level was noted to be elevated. But there was no other blood test. She didn't talk to me. She knew I was a doctor, but she didn't spend any time, discussing anything with me about other deep issues. Sally Norton goes into that much deeper. But as of 10 years ago, in my own personal history and in all the research I do, because all I do is study and go home and go to church and go to work and go to the gym. And that's about all I do in this life. And I have not seen anything in a reference point testing. You can do 24-hour urine functions for urine minerals, urine calcium, urine protein output, urine creatinine, and oxalate crystals. but it doesn't tell you any of the real time, and you're not going to get any samples. I suppose if we collected all your urine for a month when you're on a calcium oxalate elimination diet and you start dumping it, then we could do it. But it's not effective, so it's not going to be developed as a test. So I wish we could, but we can't. So I would just say take your weight in pounds and cut it in half and drink that as ounces of water, filtered water, and add 10% to that to really hydrate your body. Take a good multi-mineral with it. Do some exercise regularly. Get a good night's sleep so your stress and cortisol goes down. Eat a very low carb diet, and you should do well. Another thing that you can do to help disinflame your body is take systemic enzymes. That would be the Vitalzyme or the what is it called? Vascuzyme. And then we relabeled it and it's called systemic enzymes. So hopefully that helps you. Rhonda says, "What are you a proponent of the carnivore diet?" Yes. And long-term following it? Yes, I would say yes. I have been long before all these YouTubes out on the low carb, long before um, these doctors talking about food allergies, Sally Norton, Dr. What is his name? The names are going out of my mouth. Maybe my head. Maybe God doesn't want me to name names. But all these doctors talking about the low carb diet, the carnivore diet, how to get rid of diabetes type 2 with a keto carnivore diet. We've been doing this for decades. I mean, since the 1990s. So yes, I have been for the carnivore diet. I'm not 100% carnivore myself. I am, let's say, 90% carnivore, and then the rest is vegetables for myself. So I'm a ketovore. I guess that's the new term for those of us who eat mostly meat but do have some vegetables. So we call ourselves ketovores. So yeah, I'm a proponent of it. What diet do you suggest? Well, our muscle volume mass, our mass of muscles is largely determinant on how you can burn your sugars, how you can burn down carbohydrates, how, and all the studies on anti-aging, the myosins from the trauma of the microcontractures that were producing these little waste products are signals for growth hormone and repair, anti-aging, anti-cancer, antidepressive. I mean, the signaling of the breakdown of these muscle tissues with regular rhythmic uh, uh, weight training is remarkable. And the science is now being repeated, replicated very nicely, and it's very convincing. So yeah, I think you should do this all your life. The older you get, the more you should become a pure carnivore. Now, if you're a blood type A, you're going to have to start your higher protein diet, taking digestive enzymes to help you hydrolyze or digest the protein strings into amino acids and your fats into fatty acids. A type blood doesn't have this as well. If they would just take a digestive enzyme with every meal they eat, they will see a tremendous long-term benefit and a resiliency and superior health. What ratio of protein, fat, carbs? Rhonda, I would say that's more on a personal basis and age appropriate. So, of course, children who are rapidly growing, their needs for protein and fat are tremendous. Unfortunately, our American Dietetic Association, our corrupt government, and CDC, FDA, HHS have all destroyed the health of America by having the school lunch, the hospital, the military programs, the uh, nursing assistants, senior centers. All of them have these lousy processed food carbs, and yet we need to be made of protein and fat. So if you were to say, what do I think is a good ratio? I would say, your diet should largely be fat, then second most protein, and then thirdly, carbohydrates that are real, natural occurring carbohydrates. and no processed food, nothing processed. So there's 0% for potato chips or cereals or anything that goes through processing. So if you gave it a percentage and you held me down to that, I would say 60% fat, maybe 30% uh, protein, and then I would say 10% complex carbohydrates. That's how I would do it. Lisa says, I have a total cholesterol of 245. My doctor is trying to push me to take statins. I don't want to take them due to many side effects that others have experienced. How do I find a doctor that won't push statins? Pray. You should be praying. You should call 202-224-3121. This is to the switchboard at the Capitol in Washington, D.C. The operator will say, Capitol switchboard, how can I help you? And you say, give me to the HHS secretary, which is John F. Kennedy Jr., or give me the name of your congressman or the name of your senator or the FBI or the director of the CIA, whoever you want to talk to. And then you'll usually get a phone message and you leave your concern there. And if you're concerned about the healthcare system and it being bought off and controlled by a oligarchy of business and company people in pharmaceuticals and in the insurance companies, this kind of corruption, let them know your feelings on that and get government out and grants out of these schools. Have local fundraising for any college, any university, any medical school, any hospital. We did it before. All these places were raised up by missionaries. The vast majority of the universities in England and Europe and the United States were all Christian-based, raised up by the heartfelt service ministry of the people that lived in the area, and it served them very, very well. So you have local control and accountability. And then tell them what you think, that you want doctors who are not caught up in trying to serve an insurance master and a board master. If a doctor harms you, you take them to court. And if they have been found in a court review and system of peer review, a jury of their peers, then they should pay for it. We don't need these boards. We need local accountability, no master systems, okay? Local control. James says, hi, Dr. Rita. Recently you said you had a root canal tooth removed. I have never had a root canal because of the toxins, etc. And I agree. But you know, life happens. And in the midst of me being a doctor with children and marriage and patients and responsibilities and waking up with a terrible sore throat and employees to pay and doctors' salaries to pay and rent and rental and the supplies and the IVs and the rental of the space and nursing salary and all these medical assistants. I didn't have the luxury. I was in pain. I went. They said, we could make you feel better if you let us take care of this right now. And I succumbed to it. So prevention is the best way. But, you know, I am really disappointed. I have really not had doctors that told me anything about preventive dentistry. But the only reason why I knew about it is I went through that doctorate of integrative medicine 1999 to 2000 for 2 years. Capital University of Integrative Medicine. It's now closed, but it ran from roughly 96 to 2010, something like that. Anyway, in that period of time, we had the dental mercury, root canal, all these wonderful teachings of how horrible it was. So I felt really bad that I had that one tooth, and then eventually it bit me in the butt, and I had to have it pulled out. There you go. So recently I saw an integrative endodontist that attempted regenerative endodontics, ozone wash, among other things. They advised that if that didn't work out, they would do a special root canal with a sealer. Your thoughts? Well, James, um, I have ozone therapy, and here I'm trying to encourage you and motivate all you to do the right thing. I need to get my own body motivated to walk, 150 feet over there to get my own IV or ozone treatment for my own teeth. Fortunately, I got my IV and my high-dose vitamin C. I didn't get the ozone. I should get the ozone. So yes, I'm in favor of it. And yes, that knowledge and research has been available for a long time. So I would do that and give it a try. I think that's reasonable, James. Go for it. We have a new question here. It says, I sent an email. I have had a bulging hernia above my belly button for 5 years or so. I have been keeping it at bay by using gut healing herbs, probiotics, eliminating sugars, flours, and uh, I am a careful Pilates performer, I guess. She goes on to say, careful when I'm exercising and doing weightlifting outside of surgery. Is there anything you might suggest to keep or heal the hernia? The answer is no. Once the tissue is broken down like that, and you're left with the own healing of the other tissues that make up your abdominal wall, the rectus abdomini muscles, some of the latissimus that wraps around. So doing abdominal crunches is something that you need to do and do them regularly. Planks, maybe things like that, that would be extremely valuable for your stomach wall health. What they're worried about is a loop of small intestines working its way in through that hole and then poking out, like that, and then getting stuck there and then becoming a source of exsanguination, pinched off bowel, and having blockage, and then a serious mess to deal with on emergency basis of surgery. So I tell all my patients with either any hernia to have a general surgeon take a look at them. And I am not an expert in this. So I say, see the general surgeon, get them to estimate what it looks like, what their experience is. I have often recommended Dr. Andrew Shadid, Shadid, in Newport Beach. He was the head of surgery there for a long time. He's still doing it. He's a wonderful doctor because he's not trying to sell you a surgical procedure to pay off his house or buy another yacht. What he's trying to do is practice good surgical medicine and remedies. And he likes my patients because he knows I send them there for a true assessment of how impending a problem may or may not be, if it can be managed conservatively. So I would say Andrew Shadid in Newport Beach is who I would see. And God forbid that it worsens suddenly. You would go to Hoag Hospital where he knows you and his fellow surgeons are there and they can communicate with one another, like our doctors here that worked with each other. We meet every Tuesday, and we every monthly, the second Tuesday of every month, and we have these uh, uh, discussions on general health and answer questions with one another about patient care and patient reports, new science, whatever. And so Dr. Shadid has this group there, so he's very good. Maybe that'll help you. Debbie says, Dr. Rita, you look absolutely beautiful today. Oh, well, bless your heart. Let's see. I am going to have to give you a blessing somehow. Well, bless your heart. Thank you, thank you, thank you. I do believe if we take care of ourselves, we don't have to have hip replacements. We don't have to have lenses put in and cataracts removed and, implants or explants or whatever. I think my worst thing was I had a root canal under an emergency situation, praise the Lord, and a kidney stone. And otherwise, I try to do what I'm telling you all to do. I am trying to drink the water, be low carb, do the weightlifting, get to bed reasonably early with the lights out, get up with the sunrise ground, get that infrared light. I have an infrared bath in my booth, rather, in my bedroom. And I take my supplements very religiously. I'm 99% good on that. I take my Juice Plus. I take my iodine. I take my natural hormones. Nothing is replaced on me. No hip replacement. Nothing in me. No hair dye. No facelift. No Botox. Nothing. And we were designed with the estradiol, which I put on my face, which helps with elastin collagen to be supportive. So we're designed to heal. And if you love yourself, as you should love yourself and love your neighbors as yourself, is what I'm saying in the Bible. So there should be a healthy respect for caring for yourself so you can be of ministry to another. And so I'm trying to do this to care for you. So it's very lovely of you to say that. Thank you so much. That top color and lip are perfect. Top color. Oh, you mean this is my workout shirt. This is my my weightlifting shirt. Thank you. I guess the color is good, is what you're probably saying. And just had to say that. So my question is, what are the various ways to lower my blood pressure? I exercise 3 times. Debbie, there are so many things. I would, of course, say EDTA chelation with microcirculation. We have minerals, magnesium, zinc in there. We have the vitamin C in there. We have the selenium trace minerals. We have the B vitamins. It helps with microcirculation, not eating at late. If you would stop eating around 3 o'clock in the afternoon, drink half your weight in water, try and get a good night's sleep, use your natural hormones, especially the progesterone at night to sleep. Try and drink most of your water in the day so you don't have to wake up in the middle of the night and disrupt your sleep, because that's the only time you heal and repair. So we want good sleep. And that will help with your sympathetic tone. So I really believe high blood pressure is a function of our metabolism, meaning sugar, and the thickness of the intima, the lining of the wall, the thickness of that wall can get thicker and stiffer if we have too much insulin, starch, carbohydrates. So having a very, very low carbohydrates in our diet is quintessential. Stand, having done all, stand. Drinking your water, not eating late, taking your enzymes, doing chelation, taking magnesium, relaxing multiminerals, and natural hormone repair, a good night's sleep, maybe grounding in the morning with the infrared sun, and you should do well. I don't know where your blood pressure is. That your name sounds familiar, but that's the general advice we give to everyone, and it has always worked. Why it shouldn't work for you, I think it will work for you. Jenna says, hi and blessing to you. My healthy 69-year-old husband had a recent prostate biopsy. After a PSA of 5.3, 5 samples were benign and 7 were group 1, lowest Gleason score of 6. Okay. It is considered slow growing. Second message from Jenna. Urologist said we can watch it for now. Absolutely. I wouldn't touch anything. Surveillance method in addition to prayer. My husband is taking 24 milligrams of ivermectin and 222 of fenbendazole daily. What do you recommend? Well, I recommend all the healthy life things, styles we do. You can listen to the earlier part of this about it, the water, the carbs, the sleep, the grounding, the light, the rich protein, the exercise. All these things are necessary, but there are other things that would be helpful. We would need to look at his testosterone level and his estradiol level. I would tell him to stop drinking alcohol. We need to see his insulin level. The insulin, anything above 4, is going to stimulate growth of tissue and masses in your body. So I would have him see a good functional doctor who will look at things like giving him selenium, giving him systemic enzymes, checking his estradiol, checking his testosterone along with the PSA, checking the insulin and the glucose, and the triglycerides should equal the HDL and not worry about total cholesterol or LDL cholesterol, really. Weightlift 3 times a week and walk briskly at least a half an hour all the other days, and then enjoy service to others. And he should have a good history and physical. There may be unique things. Find out his blood type. If he's an A, he needs digestive enzymes in addition to systemic enzymes, but try those things. The next one is Carmen. Carmen says, would there be any risk for someone in their 90s having a CT scan with contrast? No. I've heard the iodine could injure the kidneys. No. Same question about the risk of a colonoscopy for 90-year-olds. Thank you for the benefit of your wisdom faithfully every Tuesday, Carmen. In general, the older you get, the more likely you have a decreased function of everything in your body. Kidney function, creatinine level would be checked. I think it should be checked before he gets a dye. There's an iodinated complex that they use as a dye for certain scans, but usually they use gadolinium complex to another molecule for dye in the other CTs. So we can get this removed if we do EDTA chelation. And John F. Kennedy Jr. Is making EDTA chelation finally, someone in the HHS who is going to support these 80 years of us using EDTA chelation to help people like my patients get to their 100th birthday party like I went to last week, and the 90s parties that I've been going to of recent. So EDTA chelation improves microcirculation and helps people detox and helps blood pressure microcirculation. So I don't see a reason why a 90-year-old couldn't do that, unless they had terrible kidney function. But then, interestingly enough, EDTA chelation therapy is the treatment for much of this chronic kidney disease. And there are many studies, at least 12 that I know of, on EDTA chelation by nephrologists who have shown improvement in kidney function, getting people off of dialysis and helping them to get better performance and mobility in life. It may not be restored back to normal, but EDTA chelation is the treatment, part of the treatment for kidney repair. Chuck says, when you are in your 60s, is testosterone beneficial for libido and muscle retention? Absolutely. Also, at this age group, what should be the levels? Above 500? Yes, absolutely. And you have to remember, in the year, there's a biannual level. So in the January, February, March, and April is the lowest. So the lowest part is January, February, March, April. Then June, July, August, September, October, November, December are the highest. November, December are the highest. So God wants all the little boy animals and men to get all the girls pregnant. But God then makes it the level of production by the universe and electromagnetic impact, so that the production of testosterone drops off somewhere in the winter time when the babies are in gestation. And so when the mothers have all their little puppies, then the boy dogs have lower testosterone, and the boy bears and all the boy animals, so they don't eat the pups up. So men have a biannual phase, low in the winter, high in the late summer and early fall. Girls and girl animals have a monthly cycle. We're up and down all the time. We're very labile, impacted largely by moon, the geomagnetic impact of the moon cycles as well. So in the days when I started practicing medicine in the 70s, the men's testosterone, and certainly when I got on active duty, the men's testosterones were like 1,500, 1,600. All through the years since then, I've been practicing 44 years now, they have been coming down. And so men are getting happy over a 5, 6, 700 testosterone today, when that would have been the low winter reading of men back in the 1970s. So relatively speaking, comparing to the herd, a 500 for a winter reading today is good. I would prefer it to be 700, 800, and then your late summer, early fall to be, 1,500. but that's how that story goes. Julia says, for about 5 years, I've been managing a hernia above my belly button. I've been using herbs. So I answered that already. So that was in one of these questions. And Leah says, I had insomnia my whole life. Xanax is the only thing that helps. I take magnesium, cortisol manager, ashwagandha, Relax Max, cherry juice, theanine, CBC, and THC gummies, exercise, morning light, GABA, melatonin. I've tried everything. Is there another medication that is not as harmful as Xanax? Hydroxyzine didn't work. Lisa, I don't know. Yours is a more complex scenario. I would just hang in there and still do the grounding in the morning with the infrared light and get to bed with lights out. I would not eat past 3 o'clock. I don't know how old you are, but Leah, if you are, 55 or older, I would flip to eating breakfast rich in protein and protein snacks and a lunch and finish up by 3 o'clock. See if that helps you. Are you on natural hormones? You should be on progesterone. Even if you had breast cancer, you should be able to take progesterone. So I've given progesterone to all my post-breast cancer patients, and they've all done well. There's studies, a retrospective meta-analysis of over 22 studies all the way back to 1980 have looked at women post-breast cancer diagnosis and treatment, and then going back on hormones, and there was no increased mortality or recurrence rate in all those studies that they had to look at. So I would say natural hormone replacement therapy, both estradiol and progesterone. But if there's some reason you can't take estradiol, if you had a breast cancer or something like that, then I would give you progesterone. But I still give women post-breast cancer estradiol as well. So it depends on the situation. But ask about that. Let's see. Then we have Witzlock. Hi, Dr. Rita. I have heard you recommend certain vegetables that are good to add to a mostly meat diet. These include spinach, correct? Although that's high in oxalates, but if you have it only once every 4 days, it's not much. Brussels sprouts, yes. Asparagus, yes. String beans, etc. Please explain why these. Well, these are basically low natural complex carbohydrate vegetables that when they're cooked, buttered, salted, and peppered, they're tasty, they're chewy, they help with mastication, signaling of satiation. They provide bulk. They have some soluble and insoluble fibers that help with gut health. So those are usually very easy to get a hold of. There are others, but those are my simple 5 that I have used. And then Spice Sky Hydra 55. I don't know how to say that. I have stage 4 metastatic prostate cancer, taking 120 milligrams of ivermectin daily. I fainted. Emergency room doctor said taking the ivermectin cause of this fainting. Do you agree? Well, I would have, no, not necessarily. What are the side effects of higher dose antifungals in the body? There can be some liver injuries. There can be some, I can't recall right off the top of my head outside of liver function issues, because I had one patient who took higher dose fenbendazole and had a similar thing, but also had an anemia. I don't know if ivermectin can lower the red blood cell production in the bone marrow for a season. Now, this other guy backed off. He's much better, by the way, with his stage 4 prostate cancer, and his PSAs have been coming down. And I am not treating cancer. I can't treat cancer. I'm not an oncologist. But those who ask me, I'm aware of the internet information that's out there on the Joe Tippin protocol and many other protocol blog sites. Most everyone is not on a daily dose. They're on a 3 or 4 day cycle and then 3 or 4 days off. They're mostly on 444 milligrams of fenbendazole. The ivermectin I have not seen as high as you're stating at 120 milligrams. I don't know how many pounds you weigh. Let me see the highest I've seen here on my machine. And that is, yeah, I think, yeah, I have never seen that high of a dosing. So I would want to see the rest of your other labs. What was your blood count? What was your liver count? Find that out. And how did you come up with that 120 milligram dosing? And that's the direction I would go. But no, I wouldn't necessarily pin it on the ivermectin unless you have a known abnormality in the lab or something like that. But check your blood count, check your liver enzymes, and look at your poop. If your poop is black, then you're having bleeding intestinally. If you throw up coffee grounds and it looks like coffee grounds, then you're throwing up digested blood. So yeah, have that looked at and find a doctor in functional medicine who is grounded and can understand, and try and work with your oncologist. We have more and more oncologists that are looking to be pleasantly available, more communicative with the functional doctors working together, both nutritionally. So there you have it. Lisa says, no, that's Leah. We did that already. Oh, I guess I was on the other side of the page here. Lisa also says, at 9 months old, my grandbaby has not quite doubled her birth weight and falls below the growth chart. Otherwise, she meets all her milestones. She nurses 6 times a day and has a 4-ounce bottle of breast milk before bed. I want to just point out pure breastfed children at 9 months are going to typically have a lower birth weight than these carbohydrate synthetic formulations and the things that these children are given. So if she's meeting all her other markers and she is at the low end for the birth weight or just under it, I wouldn't worry. Because it sounds like she's doing very well with all that eating and the breast milk in the bottle that's even for her. She started eating solids and crawling. The doc wants a formula supplement. What do you recommend to help her grow? Blessings. I would demand from the pediatrician that he give the mother the scientific articles that show the need for formula supplementation when they're meeting all their mile markers, everything else on the lab and the exam is fine. Why would just being slightly underweight from a population average, because population averages, we have an epidemic of obese newborns. So don't compare healthy children with healthy mothers that are feeding them breast milk with the general population of babies that unfortunately we're having an obesity epidemic of a newborn obesity. Okay, so demand to see the article that shows the risk. And you'll find he won't have it. And if he gives you an article, you'll see them referring to these are a population of babies whose mothers were prior addicts or had disease problems, or the child is showing other signs of slow development. So if all the other mile markers and she's starting to eat some food and crawling, then I would say, I don't think you have anything to be concerned about. Get a second opinion from another pediatrician. Sharon, have you had any experience with neurofeedback? I have patients that have done neurofeedback. It's good, just like doing physical therapy, post-concussion, post-head trauma, post-spinal cord trauma, nerve damage. When they do physical therapy, that's like neurofeedback. When you constantly repeat the motion or play the piano, you're giving neurofeedback on how and which things to hit on the chord or in the therapy. So yeah, I think neurofeedback is very good. Susie says, I am completely carnivore. I only eat beef, chicken, pork, and lamb. I test myself often for ketosis with a keto urine stick and the blood finger stick. The results frequently come as not in ketosis. Am I doing something wrong? I eat no carbs and no vegetables. I have some heavy cream in my coffee, but it has no carbs. No, your body has come to an equilibrium where you're generating gluconeogenesis in your liver, and it is producing a stable level of glucose to energy demands of your body. So don't trust on those things. So find out what your fasting insulin is, and finding out what your glucose is, your triglycerides are, and your hemoglobin A1C. Those are the things to go by. All right, and then let's see. Tiziana said, for my frozen shoulder female patients, I recommend all you taught me. Oh, praise the Lord, about diet and lifestyle. And then I also mentioned natural hormone replacement because your joints have estrogen receptors. Yes, indeed, they do. They ask if there's a substitute for ibuprofen. Any thoughts? Thank you. Well, yes, the systemic enzymes. I would carry, Vitalzyme or Vascuzyme or systemic enzymes that have serapeptase, bromelain, all these kind of systemic enzymes, and take it on an empty stomach and use like 5 twice a day for 2 weeks while they're regaining their range of motion, and drink that water. Take some good vitamin C for elastin, collagen repair, and the proteins to rebuild your cartilage and tendons and so forth. Fasting stimulates growth hormone repair. A good night's sleep helps it. Grounding will help it. Chelation therapy will help it. But there you go. Carrie says, love you. You helped with my son a while back, and I'm so thankful. Well, praise the Lord. Praise the Lord. To him be all the glory. We are here to bring glory to him and pleasure to him. It says in Revelations, we were created for his pleasure. We were created. And our duty at the end of the Gospel of Acts, it talks about Luke, rather, it says, go therefore and make disciples of all nations, teaching them whatsoever I have commanded you in the name of the Father, Son, and Holy Ghost. So we're to teach about our wonderful Father in heaven and his plan and his commandments. And we're to try and be obedient to them so that we're an example. None of us are perfect, but we're to try always. And it is a ministry to be a doctor. I hear so many people talking about how messed up medicine is, and science, and finance, and the churches, and the education system is. Everything's all messed up. Well, you want to know why it's messed up? It is because we've abandoned the obedience and the love and the demeanor of what it means to be submitted to the Almighty, our Father in heaven, and let the Holy Spirit, if it's his will, read the Bible, find out what he wants, reread it cover to cover, and go deep with him and talk with him. He and the Word are one. And thy word is health to all my flesh. I tell you, I can't believe how healthy I am in my 70s with even the marginal input I've had for time for exercise, and his grace to me. We are designed to heal. Written within our DNA in Psalm 139 is the DNA for what he expects. And, it says in Job, yea, though he slay me, yet will I trust him. So when I don't understand what's happening in my life and the hurts I have or things that happen, I tell you, I just trust him, and I treat my brothers and sisters that come here like family. I'm supposed to treat his creation. You people are his massively best creation. You're made in his image. So I get to touch and hear all you people And I'm very aware of the responsibility. So, um, to be a doctor, to heal up what this problem is, we got to get rid of this idea of being a fancy star doctor, wealthy doctor, party doctor, vacation doctor, super dressed up, jewels or not jewels, or And by the way, I'm a girl. Yes, my first goal is to be a good daughter, then to be a good wife, then to be a good mother, then fourthly, a good doctor. So the greatest calling in my life was to be, uh, as a girl, he was pleased to put me in a female container. And I want to honor my God by being a good daughter, sister, wife, and mother. Now, I haven't been as good as I should have been in those areas. And I was talked into saying, oh, your children will be fine. You're such a good doctor, be a doctor. And so I went with the praise when I should have stayed home with my children more. But fortunately, by the grace of God, things turned out and God had mercy on me and heard my prayers. But I do not look at my medical degree as anything I'm proud of. The greatest thing I'm proud of is my marriage, my family, my sisters, my mom and my dad, my children, now my daughter-in-law, my grandson's family. That's the number one thing I'm proud of on this earth. Secondarily is my professional practice of medicine. So ladies, don't look to be a professional of anything. Be a Proverbs 31 woman, and be proud of being a woman and the gift of being in a female container. Honor God's plan, and he did make the men the head. Now they should study the Bible themselves, the men, to find out what does it mean to be the head and bear that responsibility, which is a heavy responsibility for men. And so I said all that because of why. She said such a kind thing to me. So I'm so thankful that I was able to help your son. That's my reasonable service. And we'll end with Perry Lynch and said, when you have some time, extra time, yeah, right. Would you dig up a picture from 5 years ago, then next to it, a current picture? You are aging backwards. Bless your heart. See, you made my day. Thank you, Perry. God bless. I'll see you next week. Like and subscribe if it's a help to you. Thank you. Bye-bye. There we go. End stream. There we go.